Thank you, Aaron. Good morning. I'm Russell Myers, CEO of Midland Health, and this is Tuesday, April the 14th. Numbers in Texas today, just short of 14,000 confirmed cases. In Midland County, we have 32. There have been 287 deaths in Texas and 2 in Midland County. Our testing from the hospital's off-site testing location, now over 800 tests. 35 of those positive. That includes a few duplicates, 729 negatives. We're still waiting on test results from 50 patients. That's just the past couple of days. In our hospital census numbers, 120 overall in the hospital. Our emergency department saw 85 patients yesterday. We've been strangely consistent day after day in the mid-80s now, still very low volume for the ED. Critical care at 14 this morning. Among our persons under investigation for COVID, we have 4 in critical care and 11 in med-surg environments for a total of 15. Only 2 of those positive confirmed so far. The last number to report, ventilator use, 7 ventilators in use today of our 40 full-service ventilators, 44 capacity of full-service ventilators. A little financial update from the hospital. We have begun here lately to talk about the financial impact of this now extended pandemic experience. We will close the books on March here in the next day or so, and we're looking at about a $3 million bottom line net loss for just the 1 month, wiping out about 3/4 of the gain we've made so far this fiscal year. With a full month in April expected to see a downturn in activity and a minimization of elective procedures, losses in April could be double that. We could be looking at $5 or $6 million. So very significant financial impact. We believe at this point that we're able to ride it out through April. We've been fortunate in our early receipt of $3.7 million from the CARES Act distribution. About $100 billion was assigned to hospitals around the country. The first $30 billion has been distributed now, and of that we got $3.7 million. So that's about enough to overcome the losses we saw in March. We also are expecting within the next day or two an advance from the Medicare program to give us some cash flow. This represents essentially a short-term loan from Medicare that has to be paid back after 120 days. So we have some serious financial challenges ahead of us. We are staying the course currently. We've had good conversations twice now in the last few days with the finance committee of our board. We are very intentional about keeping things essentially as they are through the month of April. That means keeping our employees at work, keeping our benefits intact, continuing to do everything we can to serve our community as best we possibly can, and to keep our workforce preserved and healthy. If this extends well into May and beyond, I think we will have to look at some challenges, make some expense reductions, look for other sources of revenue. But as of now, we think we're in reasonably, the financial hits have been significant. So there'll be more to come on that as we get through April and see how soon we're able to return to doing elective procedures and reactivating most of the work in the hospital that's been shut down through the pandemic. I'd like to commend our human resources staff this morning. We've had some real challenges. As you all probably know, healthcare turnover is pretty continuous. We're always sourcing and hiring new people, managing benefits concerns, during the course of this pandemic, dealing with a lot of policy change, interpreting new guidelines coming from the federal government and the impact they have on our employees. Our human resources team, for the most part, has been working from home, but they've been deeply engaged. They've come up with new methods for hiring people, for sourcing candidates, for orienting new employees right through this crisis. They've been real troopers and a real vital part of the team here. So today's shout out to our human resources team. Thank you all very much for the work you're doing. That is the end of my prepared remarks, and I'll take questions at this time.
Media, do you have any questions? Oh, Stuart with the MRT is wondering if the hospital district was approached with the chat initiative as well.
I'm not sure what we mean by approached. We're aware of it. I'm actually participating myself. Judge Johnson introduced it last week, I suppose, and I think my impression of the chat initiative is that it gives us a unique perspective on the broader community's health. It does so, of course, if people participate, and I think it could be a useful tool among the many tools we're using to try to understand the impact of this disease, not just on the people who are sick enough to come and get tested or be in the hospital, but on the broader community.
And then the next question is, how many total beds are available right now?
Total beds available in the hospital. Let's see, we've got 120 patients in the hospital, so that's about 120. I think our total capacity is 244, if I remember correctly, so 124 total beds available.